We know that COVID-19 is a mild disease in the vast majority of people. 85% of people who contract COVID-19 have few, if any, symptoms at all. Another 10% or so actually become ill the way you might with the flu and need to seek medical care, but only a very small number actually require hospitalization. And although any deaths are tragic, only a tiny fraction have died from this infection. Coronaviruses are especially good at it. The reassuring news is that most mutations end up making the virus weaker or less lethal rather than more. Outside of New York City, this virus has essentially been a nursing home problem. The general public has simply not been impacted the way the media and public health officials have led us to believe. Given everything I've just laid out in terms of the nature of the virus itself and those who are truly at risk, I can say that the national response to COVID-19 was horribly misguided. Let's start with the idea of social distancing. Social distancing isn't even an established healthcare concept, and certainly not one in the public health. The whole idea of social distancing was based on a theoretical model explored by a high school student in a science fair some years ago, looking at how an infectious disease might hypothetically spread as the result of potential exposures amongst kids at school. In other words, it was never scientifically based as a method for responding to a pandemic. What is a fundamental public health method for controlling the spread of infectious diseases is quarantine. In quarantine, the sick are isolated, kept indoors, away from others, and those who are at significant risk, the elderly and those with underlying diseases, are protected, say by the wearing of masks in public. Keeping healthy people isolated from one another simply isn't necessary. Masks are intended for the ill, when they will be potentially in contact with others, and for those who are caring for them. Multiple medical authorities, including the World Health Organization, the CDC, the New England Journal of Medicine, have now all acknowledged that there is no scientific justification for normal, healthy people to be wearing masks. In fact, prolonged mask wearing actually increases the risk of disease to the wearer. People tend to touch their faces much more often when they're wearing a mask. In addition, we end up rebreathing particles that our lungs have exhaled, whether it's pollen, dust, virus, or bacteria particles. They are trapped in the mask, and on the very next inhale, we breathe them back in.